Then I introduced.
Welcome to the Best of Beaver County, presented by St. Barnabas, a weekly segment dedicated to putting the focus on the amazing things and the amazing people behind them in Beaver County. The Best of Beaver County is sponsored by and content is provided by St. Barnabas. The show airs every Thursday from 11 to 11:30 on WBVP, WMBA, 99.3 FM, and Facebook Live. Now, with no further ado, let's welcome host Mike Romai to introduce today's program.
Good morning and welcome to the Best of Beaver County radio show on the St. Barnabas Radio Network. In southwest Pennsylvania, St. Barnabas has been caring for people since 1900. Today, in Allegheny, Beaver, and Butler counties, we offer a full continuum of care for our residents and patients. This includes luxurious retirement living, personalized living assistance, and hands-on skilled care in our nursing center. Additionally, the St. Barnabas Medical Center offers the following health services to the community and our residents: a full dentistry, home health and home care, hospice care, and palliative care. As a leader in the healthcare industry, St. Barnabas continues to be focused on the needs of our community and our residents now and in the future. Bearing witness to its founder's reminder, God is able, men and women are invited to join St. Barnabas in the work of continuing Christian caring, healing, and teaching as St. Barnabas continues to offer trusted healthcare services to both its residents and the community. The intent of our radio show is to introduce you to successful individuals who are making a difference in the greater Pittsburgh region, and each week our guests will provide enlightening conversation. As a trusted source in healthcare, St. Barnabas Health System, along with the American Cancer Society, is proud to be a part of today's conversation to participate in the Great American Smokeout campaign. For those who are starting the Kick the Habit journey today, we can't think of a better way to help you than to talk with Dr. Kerrigan, Director of General Medicine at the St. Barnabas Medical Center, and Dan Tubin, Director, Regional Integrated Marketing from the American Cancer Society. Dr. Kerrigan and Mr. Tubin, welcome to the Best of Beaver County. Thank you for coming and participating.
Good morning.
Morning.
We appreciate you both being here on this important day because I'm old enough to remember when they first had the Great American Smokeout Day. How many years ago was that, Dan?
Oh, it was, I hate to say this to you, but decades ago now.
Decades. It was decades ago. But I remember it well, and I remember it used to be a challenge sort of to people to try and say, well, I'm going to smoke my last pack the day before, and then I'm going to try and give it up on the Thursday for the Great American Smokeout.
Yeah, the whole thing is, make this day one.
It's the first day of the journey. Dr. Kerrigan, tell us a little bit about yourself and your relationship with St. Barnabas.
I am originally from Pittsburgh. I grew up out on the West Coast, so in Washington State, and after I graduated, I've been gradually moving back east. I went to medical school in Chicago, did my residency here at Allegheny General in internal medicine. I moved down to Virginia for a few years, and then, like all Pittsburghers, I moved back when I got married. Mm-hmm. I have been at, I'm currently the Director of General Medicine at St. Barnabas Medical Center, and I'm the Director of Hospice for the health system, and I've been with St. Barnabas for almost 20 years.
It's amazing. And so we were talking a little bit about snow flurry activity prior to going on the air. You spent time in Chicago. Snow flurry activity, Western Pennsylvania weather's nothing compared to what you probably witnessed and experienced in Chicago.
No, you're right. We got snow, and we got the really cold winds off the lake. So this isn't as bad as what I've been through in the past.
Very good. And tell us, the changes that have gone on in your career since the very beginning, and especially in the last 20 years in the medical profession since you've been involved and had a relationship with St. Barnabas.
Oh, well, when I started with St. Barnabas, we had the medical center, the retirement village, and at the nursing home. But since then, St. Barnabas has expanded out to Beaver County. We have the Beaver Meadows Nursing Home. We have a dentist office out there now, and we have Conley's golf course up in Route 8. So St. Barnabas has expanded quite a bit, and we've expanded our services. We have a hospice program now, which we didn't when I joined. So
it's amazing. And St. Barnabas is one of the major employers here in Beaver County over the past couple of years, and they continue to expand their footprint.
yes, absolutely they do.
Very much so.
It's a good thing.
Yes, it is very good. And smoking in the last 20 or 25 years, in your experience, in your career, what have you seen as far as changes in people who are smoking? I know, I again, old enough to remember when people used to, and doctors used to be able to smoke in the hospitals.
Yes.
How's all this changed over the last 25 years?
Absolutely. When I first started practicing, I saw a lot more smokers than I do now. I don't see that many people smoking anymore. They still do, but there is the awareness of the dangers of smoking has become, I think, much more ingrained into people. So we just don't see it like we used to. That's a good thing.
Very much. Let me introduce Dan Tobin. He is with the American Cancer Society. He's the Director of Regional Integrated Marketing for the American Cancer Society. Dan, welcome to the program.
Thank you. It's great being here today.
I guess I should say welcome back because we did this last year.
We did.
Very good. And tell us a little bit about yourself. What is your hometown?
I am from the North Hills, Ross Township in Pittsburgh. Like the doctor, I grew up here. I was actually raised here, but I moved away for work for many years. So I was up in Boston, so I do understand the snowfall.
You didn't develop that dialect. You don't have the accent from the Boston area. Did they ever say to you, you must be from Pittsburgh with that accent?
They just didn't know where I was from.
All right. And so you work with integrated marketing and the American Cancer Society for about the past 4 years. You've been dealing with this. What is the main message that you have? Were you ever a smoker?
I wasn't, but my mom was.
Okay.
And in fact, my mom smoked for 40 years. She smoked unfiltered cigarettes, which, that was about as high test as you can get.
My mother used to smoke Pall Malls.
That's what my mom did,
Yeah.
and Pall Mall Red.
Yes. And the thing I remember most, my mother passed away a few years ago, but the thing I always remember as a kid, when she'd smoke the cigarette and she'd take a drag, and then she'd always go like that, and there was always like a piece of tobacco that stayed on her tongue, and she'd always, do that. Yeah.
Unfortunately, with Mom, she did quit smoking, but she also developed lung cancer. So she's been through it twice, has 2 half lungs. It's not a pretty journey to go through, and that probably could have been avoided had she not smoked.
There's people of a certain generation, World War II generation, when they used to give the GIs cigarettes when they were on overseas deployment. It was commonplace advertising, as I mentioned to Dr. Kerrigan. We used to smoke on airplanes, in hospital rooms. Even the doctors would come in with cigarettes.
It was such a different time, and a lot of it, I think too, we didn't realize the danger. We didn't realize how addictive it was, how it can cause cancer, how it can cause heart problems as well. And once we knew that, you went through this massive education campaign for years that, it was great that the American Cancer Society was at the forefront of that to make sure the public knew, make sure the legislators knew, to try to get changes done. And now you don't see as much of smoking on TV shows or in the movies or whatever else. It's really cut back.
Yeah. Messages. Dr. Kerrigan and Dan, you could both talk about this. The messages, putting the warning label on cigarettes. There was a big fight for the industry to go through that because they didn't want to put it.
I remember that.
Yeah. Yep. The Surgeon General saying that this, that was taboo back in those days because there was a big lobbying and continues to be a big lobby for the tobacco industry and commercials and things like that. How were we able, Dr. Kerrigan, to fight through that and say, no, we need to get this message out to the American public?
I think that's been kind of multifactorial. I mean, obviously, the American Cancer Society has their programs like the Smoke Out. I see public education campaigns on TV. I don't think we don't have the ads. I remember when they used to have the ads in the magazines. So we don't have that anymore. And certainly doctors have been educated much more now, more than when I was young, on the dangers of smoking. So they hear it from their doctors. They hear it on TV. They hear it from people like the American Cancer Society. And certainly, I think everybody knows somebody who's had a medical problem that's related to smoking.
Mm-hmm. You come a long way, baby.
Yeah, absolutely.
That was a part of the women's liberation movement back in the 60s, right?
I remember those ads.
Yeah, you finally reached the male equivalency, because you could smoke, and it was cool.
Oh my gosh, and it's as the doctor said it right. People hit it from so many different angles as it became more aware of the dangers, and it took time to get to that point. And thankfully, there's not as much smoking as there was. Of course, you have vaping now in the mix, which is also an issue with it. But it is definitely not as bad as it was at one point, and hopefully one day we can knock it down even more.
Can we? I mean, because we subsidized the crop for so many years, and there's so much money involved with lobbying in Washington. Is that the major reason why we haven't been able to just wipe it out totally?
Well, I'm sure that the tobacco lobby is huge, and I'm sure that plays a big role in it. That's why I think education is so important, to educate the public, so they just don't want to use it, because that would be the way to ultimately beat that.
Mm-hmm. Dr. Kerrigan, what is it about dependency on tobacco? Why are people addicted to it? And I've heard, you can clarify this, that it's even more addictive than cocaine.
Actually, I'm not. You may be right. I mean, certainly there's a lot more people who smoke than use cocaine. But I mean, the problem is, when people smoke, they inhale nicotine, and that's a potent drug that causes physical dependence. And once that develops, it's very hard to quit. People in the past, we have help now, but in the past they tried to quit cold turkey, and first thing that happens is you start experiencing nicotine withdrawal. You get anxious, restless, increased appetite, you can't sleep, you can't concentrate, and that can last for days to weeks, so that makes it extremely hard to quit. And even people who've quit for years can still get those cravings sometimes. Mm-hmm. So,
is it relaxing for people? What part of the brain does nicotine trigger?
I think it does relax people. I mean, people will, get their cigarette and their coffee and they smoke. People at work will go outside and take a smoke break to calm down. So it does have that sedative effect, or at least people perceive it that way.
It's crazy, and we'll talk more about this, but when I worked at Gateway Center, people would stand outside of the revolving doors. It didn't matter what the weather was. Yeah. Here at this radio station, people stand on the rooftop.
Yes.
Because I worked at a time when, every time I open my mic here, I'm saying, I remember a time, and that's aging me quite a bit, but when announcers, Bill Steinbach, John Cigna, they used to be able to smoke in the studios in these places. It's incredible how far we've come, and how far can we go? We'll continue to talk about that. Grab something to munch on, not a cigarette. We'll talk about some of those other ways that people try and stop smoking, and the props that they use to help them along that path. With Dan Tobin from he's the regional director of the Regional Integrated Marketing from the American Cancer Society, and Dr. Kerrigan, who is with us. She is the Director of General Medicine at the St. Barnabas Medical Center. I'm Mike Roma, and you're listening to the Best of Beaver County radio show on the St. Barnabas Radio Network.
When you think about retirement, what images come to mind? Why not let yourself imagine enjoying an exceptional retirement lifestyle at the Village at St. Barnabas in Gibsonia? Attainable luxury can become yours because the Village has no large upfront fees, and it's based on a simple annual no-risk contract. The only decision to make is when to move in. Call 724-443-0700 or click stbarnabashealthsystem.com.
Now entering our 75th year of serving Beaver County. You're listening to 99.3 FM, 95.7 FM, 1230 WBVP and 1460 WMBA. Part of the St. Barnabas Radio Network.
We're continuing our conversation on the Best of Beaver County on the St. Barnabas Radio Network with Dr. Kerrigan and Dan Tobin. And we are talking about the Great American Smokeout, which is today. Dan, let's get back to that a little bit because, as I said back in the days when you first started this with the American Cancer Society, it was all over the place. People were excited. Now, I mean, it's not as, I guess and I don't mean this in any derogatory way, the PR is not there. People are, we're not getting a lot of the inundated with the commercials and stuff like that.
I think it's yes and no to that. You're right. As far as Great American Smokeout is as the day, you don't hear as much as you used to. But what you are hearing is the entire month because this is Lung Cancer Awareness Month. So it's sort of wrapped into that whole month is the message that, smoking is dangerous. Lung cancer is the leading cause of cancer death in this country. 25% of lung cancers can be, it accounts for 25% of cancer deaths, which is more than breast, prostate, and colon combined. And 80% of those lung cancers can be attributed to smoking. Yeah. So I think the message is now a full month, whereas, GASO is that one day. But I think you are right. You're not seeing it as much, but it's more spread out across the whole month with the lung cancer message.
GASO, acronym, and GOAT. We got all kind of things now. Greatest of all time, and now the GASO is the Great American.
Exactly.
GASO. Okay, very good. Back to the topic of being dependent and on nicotine, on cigarettes and products. Dr. Kerrigan, you brought this up, and I thought, I have known people who had smoked in the past, and when they try to quit, never happens the first time, it seems. But one of the reasons, especially for women smokers, is that I put on too much weight when I quit smoking. Mm-hmm. And other people, you got to find something to do with your hands after you have a dinner or something like that. It's become habitual. The Doobie Brothers, what were once vices are now habits, and you want to take that out. And then people used hard candies in the past to satisfy that urge to smoke.
My mom did that.
Yeah,
she did the hard candy, mm-hmm. and in addition to that, she took up at a local arts center. Took up painting to keep herself occupied, and that's how she finally got past that.
Okay, is it an oral fixation? Is it something to do with your hands? What is it?
I think part of it is if you've been smoking for years and if you smoke a lot, it's habit forming. You always have to have something to do with your hands. Mm-hmm. And some of it's, the nicotine dependence, you get the craving, and so you're fighting on multiple fronts. You're fighting the nicotine dependence, and then you're fighting the habit of always having a cigarette in your hand, or when you get anxious, I got to go take a smoke, instead of finding a different way to cope. Mm-hmm. So, that's how some of the, we have better therapies now. You have like the nicotine patches, you have the nicotine gum. People chew gum when they feel like, I got to take a smoke. They'll pop a piece of gum in their mouth. There's things like that we have available now that, like my dad smoked, and he was never able to quit, but they didn't have that back when I was a kid. So there's, I think there's better aids out there.
So what we're saying is that it is a lifelong struggle.
Correct.
Again, I mentioned him in the last segment, an old friend and colleague, John Signa, and he went through hypnosis to stop smoking. Does that work? Is that something? People are reaching out in all different directions.
Yes.
I think different.
Go ahead.
I think different things work for different people. Mm-hmm. Some people, they need the patch, or they need the nicotine gum, or hypnosis, or a support group. I think what's important is you search out what works best for you. The thing that ultimately works is what works for you, and it's different for every person. That would be my way of looking at it.
Yeah, Dr. Kerrigan.
I think, and I agree with Dan. What's the best way to quit is what works for you. But I think the most successful smoking cessation programs are one that takes a multi-pronged approach. So it's not just counseling or support groups, but maybe it's adding a nicotine patch or gum, or seeing your doctor. And we have prescription medications now that can help decrease your cravings. So I think layer those different modalities on top of one another, that's going to help. So the more you can do to fight the nicotine dependence and then fight the habit-forming behaviors you have from smoking, that's going to help. There's even phone apps now that you can use to help quit smoking, and those will help track progress, help you give you support, help you figure out what your smoking triggers are and things you can do to combat that. There's some that will even help you with self-hypnosis. So there's something for everyone out there.
And it's the carcinogens that is mixed with the tobacco, right? Is the tobacco in itself addictive? Is it the nicotine in it?
It's the nicotine that's habit depending, but it's the toxins and the tar that you inhale in the smoke that is what damages the lungs.
And people have tried different things over the years. People who tried to stop cigarettes, smoked the pipe, or tobacco,
Right.
or cigars, or nowadays it's vaping. Younger generation is into vaping because they think that's not as hazardous to your health as smoking. What do they have wrong about that?
Well, in a complete sense, we don't know the long-term effects of it yet, but it is dangerous. You're inhaling still all those chemicals as a steam. And our stand is you shouldn't use any type of tobacco product whatsoever. What's especially dangerous about vaping is the companies that are marketing, they're marketing to the kids with the flavored, all the different scents and stuff. So they're trying to hook this younger generation. But it is, in my opinion, it's equally as dangerous as tobacco.
Dr. Carrigan?
Yeah, I mean, I agree. We don't have a lot of long-term studies on the e-cigarettes. They haven't been out that long. But I think the problem is people are inhaling different things. You have the cartridges, and they have liquid in them, and different companies will put different components in them to make them more attractive, or maybe to make the liquid vaporize better. There's different strengths of nicotine in the cartridges. It's hard. There's not a standardized solution that people are smoking. So you're inhaling that and taking it into your lungs, and we just don't know what's happening. Some of the components that they've studied, some of them have the potential to be carcinogenic or tumor causing. So you have to be careful.
When you talk about vaping, there's nothing, I guess, funny. There's nothing funny about it, but you're in traffic at a red light and behind somebody who's vaping in the car ahead of you, and they roll down their window a little bit and let out this big burst of smoke. It's like a cloud that comes out. There's more involved in the vaping than there is in the tobacco use. You've seen it. And one of the other things that is odd, we talk about where we don't smoke anymore, restaurants and bars and places like this, but also having kids in the car with you. If you're a smoker and you've got them, they're a captive audience, they've got to stay in the car with you, and you're blowing that smoke all over the car. What about secondhand smoke? What is the danger inherent in the secondhand smoke?
Well, secondhand smoke has been well studied, and we do have some good evidence that, and it is dose dependent. It depends on how much you're exposed to, how often, that type of thing. So, but we do have good data that it does increase risks of heart attack in people who are exposed to it who are non-smokers. People have had increased risk of lung cancer, of strokes, from being consistently over time exposed to secondhand smoke.
Dan, we must be doing something right, because in all the years that this has been going on, how many decades? A few decades.
Quite a few.
We've had the Great American Smoke Out, but you can tell if you're observant. We used to walk into somebody's house, the smell of cigarette smoke was on the furniture, it's on the curtains.
Yep.
You walk into an office to do business, and you know that the people behind the desk were smoking because you could smell it the minute you walked into the building. You don't detect that as much anymore.
No, I think even some people who smoke, they don't smoke in their own house. They'll go outside at home, and so you're not seeing it as much. I think, personally, being a non-smoker, I think when they passed laws against restaurants having smoking, it was wonderful, being able to walk into a place and not come out smelling like smoke.
Yeah, I remember, Dr. Kerrigan, when they first floated this idea that Dan was just talking about, that they tried to have areas. This is a non-smoking area, this is a smoking area. Funny thing, though, was they were back to back. And how did they control the
yes.
smoke?
Smoke doesn't stay in its designated area.
Yeah, you had to walk through the smoker section to get to the non-smoker section.
Yeah.
Exactly.
And it's going to waft across the room. Yeah. You can't contain smoke in an open area.
And Dan, what is the American Cancer Society doing today in terms of trying to get the message across?
In addition to all just the education itself about the dangers, I think one of the big things we push is to get screened, to work with your healthcare provider, not just about lung cancer, about all cancers, to make sure you're doing the right screenings for your age based on your risk factors and family history. Cancer that's detected early is much more treatable. And so the big message that we try to push is to get screened.
And the idea that you don't want to wait till you get that diagnosis.
Well, exactly. And a lot of times, lung cancer is one of them. By the time you have symptoms, it's usually very well advanced. Versus if you are a smoker or were a smoker and you get screened, it might detect something before, it's an early stage. I'll go back to my mom, for example. Her first lung cancer bout was detected very, very early, which was what saved her life. It might have been very different if she had waited till symptoms. And
you don't want them cutting pieces of your lung out left and right.
Exactly. You only have so much.
Dr. Kerrigan, besides lung cancer, what are some of the other health threats involved with smoking and tobacco use?
Well, smoking is actually the number one preventable cause of death in the United States. The three major causes of death attributed to smoking are heart attack, cancer, it's not just lung cancer, and a lung disease, COPD, emphysema. The risks of heart attacks among smokers can go up as much as six-fold compared to non-smokers. We see an increased risk of other vascular diseases like strokes. Emphysema is primarily caused by smoking. And like lung cancer, that's, people with advanced COPD, they're wearing oxygen, they're taking multiple inhalers. It's not pretty, and they struggle daily with that. Other head and neck cancers, esophageal cancers, pancreas, kidney, bladder, the risks of those cancers all go up in smokers. And even for women, the risk of osteoporosis and hip fractures goes up. So it's not just lung cancer. It encompasses a full range of illnesses.
It affects just about every part of our being.
Yep.
If the cost itself wasn't prohibitive, and that probably got a lot more people to quit smoking, as the cigarettes are now $8 or $9 a pack.
That's amazing.
Yeah. But the addiction is still out there. People are still smoking, and you got to get the message across to them before they get the diagnosis. And the idea that a lot of the smokers I've ever known, they wake up in the morning and they're coughing and they're hacking and they can't catch their breath and things like that. And you think, why do you want to live like that? But it's not always once they make the choice and they get addicted to these substances. It's hard to get off of them. I think that's the message we're hearing today.
Yes.
Well, thank you both, Dr. Kerrigan and Dan, the work you do for the American Cancer Society. Dr. Kerrigan, what you're doing with St. Barnabas and what you continue to do with St. Barnabas to get the message across about this and many other health-related issues. We thank you both for being with us today.
And thanks for having us.
Thank you. Yes. Thank
continued success on getting the message across. We'd like to thank our guests and thank you for joining us on the Best of Beaver County on the St. Barnabas Radio Network. Please join us again next time. Stay safe and live healthy.
When you think about retirement, what images come to mind? Why not let yourself imagine enjoying an exceptional retirement lifestyle at the Village at St. Barnabas in Gibsonia? Attainable luxury can become yours because the Village has no large upfront fees and it's based on a simple annual no-risk contract. The only decision to make is when to move in. Call 724-443-0700 or click stbarnabashealthsystem.com.
It's been stated before that working at St. Barnabas is compassionate work with excellent career opportunities. In addition, we've heard when you enjoy what you're doing every day, it's not work. But don't take my word for it. Let's listen in to what motivates their employees.
Hello, my name is Emily Tahansky, and I love to be able to help others and knowing that I make a difference in a person's life.
Find out about the exceptional career opportunities St. Barnabas has to offer by visiting stbarnabashealthsystem.com/careers for more information, or by calling 724-444-JOBS. That's 724-444-5627. Find out why St. Barnabas is apart from the ordinary.
Thank you for listening to the Best of Beaver County. St. Barnabas is pleased to have provided content and sponsorship for the program. Tune in this Sunday at 11:30 for an encore presentation of today's program on Beaver County Radio. And next Thursday at 11 for another edition of the Best of Beaver County on WBVP, WMBA, and 99.3 FM.